Have you ever been told you have sciatica and then heard someone else say it's actually radiculopathy? What if both are true and treating them the wrong way is making your pain worse? Sounds familiar? If you've ever felt confused or stuck in pain, this video is exactly what you need. This video will change the way you think about your pain forever. Stick with me for just a few minutes and you'll discover a simple connection between sciatica, radiculopathy, and lumbar disc problems that almost everyone misses, and the surprising way to fix leg pain without surgery. You won't want to miss this if you're serious about getting rid of your pain for good. Also, in just a few minutes, as a bonus, I'm going to give you 2 exercises that you can do right now to alleviate your leg pain, even when you're sitting at your desk. Trust me, these quick exercises can make a big difference. By the end of this video, you'll walk away with a clear understanding of the connection between sciatica, radiculopathy, and lumbar disc issues. Instead of just managing symptoms, I'll show you how to correct the problem at its source, leading to faster, more effective results. And if you think you've heard it before, stay tuned. What I'm going to show you might just surprise you. Hi, I'm Dr. Ruminder Birk, a chiropractor in Woodbridge, Ontario, Canada. We have helped thousands of patients recover from spinal conditions such as disc bulges, herniations, degeneration, lumbar stenosis, sciatica, and radiculopathy. We use non-surgical spinal decompression as the cornerstone of our unique and proven back to life method. Be sure to hit that subscribe button if you want do-it-yourself tips, strategies, and exercises that will help you relieve and manage your back and leg pain at home. Plus, you will discover which therapies are best for treating disc bulges, disc herniations, and other spinal degenerative conditions. I upload a new video every week. In addition to that, I wrote a book called Back to Life. Imagine getting your life back while getting your health back. You can get a free copy at the link in the pinned comment below. Low back pain and leg pain can be absolutely excruciating. It affects every part of your life, from struggling to walk because of these discomforts to sleepless nights and even missing out on activities you love with family and friends. Can you relate to this? If so, I'd love to hear your story. Drop a comment below, share how your pain has impacted your daily life. You might experience the same thing others are going through, and they would love to hear your story. Even if you've had an MRI, understanding your cause of your problem, your low back pain and leg pain, can still be confusing, especially if your doctor didn't explain it to you in simple, easy to understand ways. Does this sound familiar? If you've ever felt lost or unsure about your diagnosis, you're not alone. That confusion ends now, because I'm going to explain to you everything you need to know about what exactly causes your lower back pain and leg pain in a way that's clear and easy to understand. What is sciatica? Sciatica refers to pain that radiates along the path of the sciatic nerve, which originates from multiple nerve roots in the lower back, specifically L4, 5, S1, S2, and S3. This large nerve runs through the hips, buttocks, and down each leg. True sciatica often occurs when the sciatic nerve becomes compressed or irritated, typically at the point where it passes the piriformis muscle in the buttocks. Tightness or spasms in this piriformis muscle can trap the nerve, leading to characteristics of shooting pain, numbness, or tingling that travels down the leg. This pain typically affects one side of the body and runs down the back of the leg, sometimes all the way down to the foot. So what is L5 radiculopathy? L5 radiculopathy, on the other hand, occurs when there's a compression at the specific nerve root of L5 in the lumbar spine, usually due to a disc bulge, a herniation, and while L5 radiculopathy can cause pain, numbness, or tingling similar to sciatica, the distribution of symptoms is different. It typically affects the outer part of the leg and the top of the foot, the big toe specifically, areas that are controlled by that L4, L5. In some cases, L5 radiculopathy can lead to muscle weakness, such as difficulty lifting the foot, this is known as foot drop, or extending your toes. The key difference between both L5 and sciatica can cause similar leg pain symptoms, but they originate from different sources. Sciatica is often caused by irritation of the sciatic nerve, which can result from tightness in the piriformis muscle or other issues in the lower back, and L5 radiculopathy, on the other hand, occurs when the L5 nerve root is compressed, typically by a disc bulge or a herniation. Understanding this distinction is crucial because the treatment needs to be tailored specifically to the source of the problem. For sciatica, treatments may focus on relieving pressure on the sciatic nerve, addressing the piriformis muscle tightness, or involving hip flexibility. For L5 radiculopathy, treatment should aim to decompress the L5 nerve root and stabilize the spine to further prevent irritation. The missing and often overlooked component, spinal misalignments or subluxations. When it comes to addressing lower back pain and leg pain, one key factor is frequently missed: subluxations of the lumbar spine, sacrum, or pelvis, also known as misalignment. Even through x-rays and MRIs may sometimes reveal signs of misalignment, these findings are often overlooked by medical doctors, specialists, physiotherapists, who tend to focus on disc or nerve issues instead. This is where chiropractic care comes in. Chiropractic focuses on detecting and correcting these misalignments, which can be a significant underlying cause of leg pain. By restoring proper alignment of the spine and pelvis, chiropractic adjustments can relieve pressure on the nerve, improve mobility, and help the body function more effectively. This targeted approach addresses the root of leg pain or radiculopathy, providing long-term relief rather than just managing only the symptoms. One of the most effective yet lesser-known treatments for conditions like sciatica, L5 radiculopathy, disc herniations is non-surgical spinal decompression. This innovative technique offers a non-invasive way to relieve pressure on the spine and its surrounding nerves, providing faster recovery and long-term relief without the need for surgery. What is non-surgical spinal decompression? This non-surgical spinal decompression is a therapy designed to gently stretch the spine, creating a negative pressure within the spinal discs. This helps to reposition herniated discs, bulging discs, can take pressure off the affected nerves, such as the sciatic nerve or L5 nerve root. This treatment is performed on a specifically designed table where patients are comfortably secured and the spine is gradually decompressed in a controlled manner. So non-surgical spinal decompression is done on specific computerized tables, set programs that pull on the lumbar spine in this case, getting to the sciatic nerve and the radiculopathy at the root cause. By creating a negative pressure, the table is going to pull you in a sequence of back and forth pulls and relaxations, pulling that disc, pulling that bulge and the herniation back towards center. So the centralization of the disc is crucial, which brings the pain back out of the leg, back to the cause, and eventually correcting the disc problem. By hydrating that disc, we're going to get fluid back in there. Negative pressure, vacuum effect is going to result in a long-term correction at the disc, giving you space for your sciatic nerve, your L5 radiculopathy. Patients who undergo this non-surgical spinal decompression often experience significant reductions in pain, improved mobility, better overall spinal function. By addressing the root cause and the problem, this treatment can lead to long-lasting relief. It's a viable option for those seeking alternatives to surgery. It is especially effective for those suffering from lower back pain, sciatica, and radiculopathy, with many reporting improvements after just a few sessions. At our clinic, non-surgical spinal decompression is the cornerstone of our multimodal treatment method called the Back to Life method. This approach provides long-term lasting relief from sciatica, L5 radiculopathy, and disc herniations by combining non-invasive therapies. Here's how our multimodal speeds up recovery, reduces pain, and restores normal spinal function for the long term. Chiropractic adjustments. Chiropractic care works alongside decompression to realign the spine, ensuring that once the pressure is relieved from the nerves, the spine is in proper position for optimal healing. Exercise therapy. Customized exercises strengthen the muscles, supporting the spine, improving stability and flexibility, which helps prevent future injuries. Laser therapy. Low intensity laser therapy can reduce inflammation and promote tissue repair, accelerating the healing process and reducing pain more quickly. Whole body vibration therapy helps stimulate blood flow and muscle recovery, improving overall mobility and reducing stiffness. By integrating these treatments into our Back to Life method, patients benefit from a comprehensive approach that not only addresses the immediate source of the pain, but also helps restore normal function to the spine for lasting relief. This multimodal approach targets the spine holistically, helping to speed up recovery, minimizing pain, and prevent future issues, ensuring long-term spinal health. Be sure to look for a chiropractor who uses the multimodal approach to address back or leg pain, incorporating a combination of therapies like spinal decompression, chiropractic adjustments, low-intensity laser, exercises, and more, as described in the Back to Life method. So as promised, I'm going to show you 2 exercises you can do while sitting to start relieving your sciatic leg pain. So in this bonus exercise, the first one's going to be nerve flossing. So nerve flossing, the concept here is that the nerve is obviously a certain length and we can't stretch a nerve. But what we can do is have it glide back and forth and create a movement which helps inflammation come down. It helps ease the pain and numbness and tinglings in many cases. Just doing this at your desk can help you get some relief until you get the proper care. So what we're going to do, for example, if it's my left leg, is, simply I'd like you to start with just movement, just to test how much motion creates either a relaxation or if it aggravates your nerve. If it doesn't, then what we can do is start with the flossing. So the flossing is going to be done by extending that left leg, bringing your foot up, so you're actually flexing your foot up towards you, and then at the same time extending your head back. So what we're doing is starting from neutral, flexing the foot, extending the head, and that's going to floss that nerve in one direction. Then from there, when we come back down, we're going to bring the foot down and bring our chin down. So we're actually opposite of what we started with, and tucking the foot down, flexing it the opposite way. So we're going to come back, flex, extend, come down, flex your chin, and foot the opposite, plantar flexion in this case. So back and forth, 3 to 4 sets of 10 is going to create a nice movement, as long as it's comfortable, as long as it's not aggravating the condition of your sciatica. The next one, we're going to take in the car, we can take it at home, use this anywhere you are. It's a simple application of a tennis ball, especially on the piriformis muscle. So we're going to find a tight spot in there most times. That's that muscle I was talking about, the piriformis muscle. Simply just pinning your pelvis on the tennis ball is going to create enough pressure as the ball is under the piriformis muscle. We're working on releasing some of these trigger points, creating a stretch in that muscle, and just helping ease that pain. Then as you want to move that down, you can keep it under the glute muscle. We can pin it under the hamstring muscle, work down that muscle. Sometimes even pinning it under your knee and just giving it a squeeze will relieve some of that muscle under the popliteus muscle, it's called, as it goes below the knee. And then I like to even tuck it in behind the lumbar spine. So starting at your upper lumbar spine, compress into it, let it relax, work way down the muscles of the spine. So we're really targeting the paraspinal muscles and the multifidus muscles that attach to the lumbar spine here, and just finding points that give you discomfort, pressing into them at your own discretion and not overdoing it, and just working throughout the day. Doing that in the car is a simple thing to have on the go with you. So these are some of the tips that I like to do as at home or at your desk. You now have a clear understanding of the difference between a sciatica and an L5 radiculopathy, and how addressing the root cause with a multimodal treatment plan like the Back to Life method can lead to effective, lasting relief. If you found value in this video, don't forget to like and share it with others who may benefit. And if you have questions or want to share your own experience with your back or leg pain, drop a comment below. I'd love to hear from you. Remember to subscribe to my channel now if you want do-it-yourself tips, strategies, and exercises that will help you relieve and manage your neck and back pain at home. The next video you should watch is this one, where I show you my 5-step multimodal treatment for sciatica. Go watch this video next.